Hi students, in today's video I'm going to teach you about basic anatomical terminology. By the end of this video lecture, you are going to learn about what are anatomical terms and what is its need, what is anatomical position, what are anatomical directions, what are sections and planes, what are our body cavities present in our body, and lastly regions and quadrants of abdominopelvic cavity. After listening these things, you will get one doubt. What is the need of these anatomical terms? Why we need to study them? Can't we use our general layman language? To clear this doubt, I will give you a small example. Assume a boy met with an accident while riding a bicycle. Immediately, the boy was taken to the hospital. The doctor examined him and wrote a medical report in anatomical terms like swelling and bruising on the lateral aspect of left thigh just superior to the knee joint. Later, a nurse read this report and knew exactly where to place the ice pack. Later, physiotherapist understood where to begin treatment, and even the radiologist used the report to focus the X-ray on the correct part of the leg. What if the doctor wrote the report in layman language, like pain and inflammation in upper part of left leg? Do you think a nurse and physiotherapist get to know where exactly they have to treat? Or even a radiologist will understood where he have to focus the x-rays? No, right? Because the doctor used anatomical terminology, everyone on the healthcare team understood the same thing, even though they all had different roles. And this is the importance or need of anatomical terminology. It is necessary for precision, clarity, and effective communication among all healthcare providers and ensures that everyone are speaking the same language when discussing the human body. And tell me the answer for this question. It is absolutely no. We can't use layman language. Now see this table. Here they have given few anatomical terms and their common names which we use in our daily life. The anatomical term for head is cranium. For forehead, it is frontal region. For cheek, it is buccal region. I think you guys somewhere listen buccal tablets. Buccal tablets means these tablets we didn't directly swallow. These tablets will keep this in buccal region until it get dissolved. So this is how these anatomical terms will help us. Next is orbital region. In general term, we call it as eye socket. Next, cervical region, it is neck. Deltoid region, it is shoulder. Like this, many other examples are given in this table. Take a screenshot of this table and read it twice or thrice so that you will be familiar of these terms. Next is anatomical position. It is the standard reference position used to describe the body. In anatomical position, the person stands upright, that is straight and erect. The head is facing forward, arms are at the sides, and the palms of the hands face forward. The feet are placed flat on the floor and slightly apart, pointing forward. Observe this image. In this image, a person was standing in an anatomical position. Observe his head, arms, palms, feet, everything was as I said before, right? So this position is anatomical position and it is used as a reference so that healthcare professionals can describe locations of the body parts clearly and consistently, like without any chance of doubts or errors. Next, we will see basic anatomical directions. First were superior and inferior. Both are actually opposite ups. Superior means towards the top or above. Inferior means towards the bottom or below. For example, they have given the head is superior to the chest. Correct, right? Head is superior to the chest. Next is feet are inferior to the knees. Similarly, anterior and posterior. These two are also opposite terms. Anterior is towards the front of the body and posterior is towards the back of the body. Example, the nose is anterior to the ears and the spine is posterior to the chest. Next, medial, closer to the midline of the body. Like the heart is medial to the lungs. Next is lateral. Lateral means nothing but away from the midline, like the arms are lateral to the chest. Next is proximal and distal. Proximal nothing but closer to the point of attachment, and distal is farther away from the point of attachment. For suppose the elbow is proximal to the wrist and the fingers are distal to the elbow. Next are superficial and deep. Superficial means close to the surface, like the skin is superficial to the muscles. Next, deep, that is farther inside the body, like the bones are deep to the muscles. Next is intermediate. Intermediate, nothing but between the two structures or between the two points, like our sternum, nothing but a breastbone is intermediate between our two lungs, right lung and left lung. Next two words are ipsilateral and contralateral. Ipsilateral, nothing but same side of the body, like our right kidney and right lung are on the same side of our body, and our right hand and right foot are same side of the body. So we can say these are ipsilateral. Next is contralateral, that is opposite side of the body. For example, the right hand and left foot are opposite side, right? That is contralateral. One more example is right kidney and left lung. Both are opposite side. So both we can say they are contralateral. Next we will see planes of the body. Plane is nothing but an imaginary flat surface. Observe this diagram here. The body is divided by one imaginary flat surface, right? This flat surface will called as plane. If we cut the body along with this plane, two halves, we'll get two halves, right and left half, right? These two halves we will call that sections. This is what they have given here. The body can be divided into sections using imaginary flat surfaces, all called planes. The flat imaginary surface is called plane, and after cutting a body through this plane, we will get two parts, right? These two parts we will call it as sections. And here they given the different types of planes: sagittal plane, mid-sagittal plane, and parasagittal plane. First, we will see these three. Sagittal plane is nothing but it divides the body into left and right parts. See this clearly here. They mentioned only they divide the body into left and right parts. They didn't mention equal or unequal. If we divide the body into left and right equal halves, then we will call it as mid-sagittal plane. If the plane divides the body in unequal halves, we will call it as parasagittal plane. Okay. Next are frontal plane and transverse plane. Frontal plane, it is a plane, it divides the body into front and back parts. And coming to transverse plane, this plane divides the body into top and bottom, that is superior and inferior parts. And last one is oblique plane. It is a plane that cuts the body at an angle other than 90 degrees. I'll show you some images so that you'll get even more clarity. See this image here. A person is standing in an anatomical position. The plane that is dividing the body into equal right and left halves. This plane is called as mid-sagittal plane. And next is there is a plane that was dividing the body in unequal halves. This plane we called as parasagittal plane. And next is this plane dividing the body in front and back portions, like anterior and posterior portions. This we called as frontal plane. And next is this plane dividing the body into top and bottom parts, that is superior and inferior parts. This plane we will call as transverse plane. And next is oblique plane. This plane dividing the body in an angle other than the 90 degrees. Next, we will see sections of the body. As I said earlier, a section is nothing but a cut made through the body or an organ along with the imaginary plane. Its purpose is to weave its internal structure. Here, the terms remain same for both the sections and planes. There also we have learned the same things, right? Mid-sagittal, parasagittal, frontal, transverse, oblique. These terms are same, but the difference is between the section and plane is an imaginary line, whereas the section is a cut that made along the imaginary plane. Okay, in this image, you can observe clearly the difference between the plane and the section. Here they have given the plane and section of our brain. Okay, so the body planes are the imaginary flat surfaces that divide the body into parts, whereas the sections are actual cuts or slices made along a body plane to weave its internal structure. Next, we will see body cavities. Body cavities are internal spaces within our body that mean for protection, supporting, and separate organs. And these body cavities also allow organs to change their shape while breathing. Our lungs change their shape, right? While inhalation and exhalation, like that. Body cavities are of two types: dorsal body cavities and ventral body cavities. Hope you know the difference between dorsal and ventral. One is back side of the body and one is front side of the body. Dorsal body cavities, again two types: cranial cavity and spinal cavity. Whereas in ventral body cavity, two subtypes are thoracic cavity and abdominal cavity. And again, pleural cavity, pericardial cavity, and mediastinum are inside the thoracic cavity. Whereas abdominopelvic cavity is again two different edges. One is abdominal cavity and another is pelvic cavity. Observe this image clearly. This image represents all the body cavities, both the dorsal and ventral. See here, the cranial cavity and spinal cavity are on the dorsal side of our body, whereas thoracic cavity, abdominopelvic cavity is on the frontal side of our body, hence called ventral cavities. Say this blue color structure surrounding each lung is called as the pleural cavity, and next, this blue color structure surrounding the heart we call as pericardial cavity. This table represents the cavity, its location, and the organs that specified cavity will accommodate. First is cranial cavity. Its location is inside the skull. It will accommodate brain. Next is spinal or vertebral cavity. It is inside the vertebral column. It accommodates spinal cord. Next is two pleural cavities. One surrounds the right lung and other surrounds the left lung. Main organ it will accommodate is lung. And pericardial cavity, it will accommodate heart. And mediastinum, it is the central area between both the lungs. It will accommodate heart, trachea, esophagus, and thymus. Next is abdominal cavity. It is present below the diaphragm. It will accommodate stomach, liver, small intestine, spleen, kidneys, and gallbladder. Next is pelvic cavity. It is below the abdomen. It will accommodate bladder, reproductive organs, and rectum. Next, we will see the regions of abdominopelvic cavity. There are 9 regions in total. Observe this image. There are two horizontal lines. First horizontal line is subcostal line. That is, we will draw this line below the rib cage. And second line is transtrabecular line. This is also a second horizontal line. It is drawn at the top of the pelvic bone. And now we will draw two vertical lines. These two vertical lines are right and left mid-clavicular lines. Now you can see this grid will look like a tic-tac-toe game board, right? Okay. Now we will number these regions. Okay. The first region is right hypochondriac region. The second region will call as epigastric region. The third region will call as left hypochondriac region. Fourth is right lumbar region. Fifth is umbilical region. Sixth is left lumbar region. And 7, 8, 9 are right iliac region, hypogastric region, and left iliac region. This table mentions the regions, their locations, and the main organs found in that specified region. First is right hypochondriac region, that is upper right corner below the ribs. Organs it will accommodate a liver, gallbladder, right kidney, and a small portion of the small intestine. Next, epigastric region, that is upper center. Organs will accommodate a stomach, liver, pancreas, duodenum, spleen, and adrenal glands. Next, left hypochondriac region. Its location is upper left. The organs it will accommodate a spleen, some part of the stomach, left kidney, and pancreas. Likewise, all other remaining regions, their locations, and the organs it will accommodate were mentioned in the table. Please take a screenshot of this table. Next, we will see quadrants of the abdominopelvic cavity. In total, there are 4 quadrants. As we draw lines earlier, now also we will draw one horizontal line and one vertical line to differentiate 4 quadrants. This vertical line, nothing but mid-sagittal line, means at the center of the body, and horizontal line, nothing but transverse line. And these both lines will intersect at the umbilicus region. The quadrants will call them as right upper quadrant, second one called as left upper quadrant, third one called as right lower quadrant, and fourth one will call as left lower quadrant. This table specifies the quadrant, its location, and similarly the main organs are typically found in that specified quadrant. Okay, take this table screenshot and had a quick glance of this. Okay, thank you students. That's it about this video. If you have any doubts, please comment below. We will see in next video with few more topics. Thank you.